Monica, you've had tremendous experience and brought a lot of knowledge to the healthcare industry now as General Counsel at Methodist and previously at Regional One. Can you walk us through your healthcare career path and how you entered this industry initially?
Absolutely. So my career path with healthcare started in about 2004. Working at a firm, Glencla Brown, here in Memphis, Tennessee. I had a partner who insisted that I get involved in healthcare. My background prior to that was in employment and labor defense. I worked at a firm in Raleigh, North Carolina. And I was a little hesitant. You know, I was concerned that would healthcare, quite frankly, be as exciting? I was concerned that it might be a little boring, quite frankly. But I will tell you, I've never had a boring day in healthcare. So started with Glencla Brown, working in the healthcare space. An opportunity opened up with Regional One in about the 2008 timeframe. Regional One at the time was a client. Started working with them, and I will tell you, I have never regretted that decision. You know, one of the things about healthcare that I enjoy is you have an opportunity to really live out your passion and your mission. For me, it's about my value set, and my value set is really about giving back to community, making sure that I am a part of the conversation relative to improving healthcare outcomes, and I get to do that every day. And I know through that, with Methodist Le Bonheur Healthcare, we are improving the lives of the Memphis region.
Since graduating from William and Mary 18 years ago from law school, I'm sure you've had a lot of varied and interesting experiences. Can you share with us some of your experiences that are unique to being a woman in this industry and perhaps even unique to being an African American woman?
Absolutely. I think one of the things that is critical is that we have to be authentic to who we are. You know, the reality as a female, as an African American female in particular, there certainly are challenges that we face, but I cannot allow those challenges to define who I am. You know, oftentimes we will have to work a little harder when we're at the table because we feel in order to be recognized, that means we have to put forth a little more work. But I also think we have to be authentic and understand that we are in a space for a reason. Usually when you come to the table, sometimes you're in a situation where you may be the only female or the only African American, as has been the case sometimes for me. But I realize that I have a voice, and my voice is there for a reason. You know, that I'm not just there for diversity's sake, but I'm there to bring meaningful information and my background and experience to help solve problems.
MedTech Women at CINDA has identified as one of its primary goals and focuses providing young women professionals in the industry with opportunities to interact with successful leadership women like yourself in the industry. The purpose of that program is to develop a good mentoring program so that young professionals have effective and really meaningful mentors in their lives. Will you share with us some of your experiences having mentors, perhaps being a mentor, and how that helped build your career?
Yes. You know, one of the things I will say is I'm very intentional about mentorship and learning from others. I think that is extremely important, especially as we're going along this path to learn from others' successes and others' failures. And when you can find someone that's willing to be vulnerable with you and share their story, that is so important. You know, one of the things I've done along the way, when I first became general counsel, I guess that was about 9 years at a healthcare organization, I was very intentional about reaching out to other general counsels across the state to find out about their experiences, to find out about their successes, to get advice, and to really learn their story. I've had mentors that are in the healthcare space and some mentors that are not. I've had mentors that are women, and I've had mentors that are not. And I think that's really important, that we become intentional about reaching out. Mentorship to me is something that isn't always organic. You have to make sure that you are willing to make, again, yourself vulnerable, to reach out to people and say, I want to learn from you. I want to hear your story. I want to find out about your pitfalls. And what I have found is that most people are willing to share their story with you. I think that's been very important for me because it's also allowed me to develop a network of people who I can pick up the phone and say, look, you know, I'm going through this issue. What do you recommend? What are your thoughts? Have you gone through a similar situation? And people are always willing to share. I've also been very fortunate to have mentors and people in my family who have helped me along the way. Again, not always in the healthcare space. For me, in looking for a mentor, looking for someone that I see guidance from, it's also looking at what are we aligned with. For me, I always want to be aligned with my values. And so I make sure the individuals that I select to learn from through mentorship, that those individuals have a common thread for me regarding a value system as well. You know, when I think about mentorship, you know, I have been very fortunate to meet individuals who have also reached out to me to say, Miss Wharton, I want to learn from you. Would you be willing to go to lunch with me? I take my time and I make sure I do that. You know, there's a saying that I come as one, but I stand on the shoulders of 10,000. And understanding that I am standing on the shoulders of 10,000, I have a responsibility to make sure that I'm giving back and that I'm serving as a mentor, and I willingly do that. I think it's important that we take our time to develop that space to help the generations that are coming behind us.
That's a great reminder to all of us
Yes.
women who are in, not only in the healthcare industry, but in any industry,
Exactly.
how important it is to pay forward and pay back what
Yes.
people invested in us to the
Yes.
young ones coming up today.
Exactly.
In any discussion about mentoring among women,
Yes.
of course, always the topic of male mentors comes up.
Yes.
And I think they have a unique contribution to that discussion and
Yes.
a unique perspective that they can provide to us. Would you share your thoughts on that and how men need to be part of that program?
Yes, again, you know, my mentors have been female, my mentors have been male, my mentors have been black, my mentors have been white. I've had male mentors who, quite frankly, have shared their personal stories, whether it's their family stories, but also their work experiences, people who have helped me navigate my path, which has been very, very helpful. You know, I recall one meeting that I was at several years ago where I was the only female at the table. I've never been known for being silent at the table, but on this particular instance, that particular individual noticed that I had been quiet as we were discussing an issue. And as we were about to close, he said, Monica, what are your thoughts on this particular issue? Having someone who recognizes that not only is there a female at the table, but that female has voice, and we want to make sure that her voice is heard, is extremely important. You know, we talk a lot about diversity, but the most important is talking about inclusion. And so as men are at the table, always make sure that to the extent there is diversity, make sure people feel included. And when there is not diversity, make sure you're intentional about bringing people to the table, because we learn through experiences. All of the data supports that when you have diversity, companies do better, people thrive better, problems are solved in a more efficient way. And that's diversity not only in female and male, that's diversity in age, that's diversity in thought, that's diversity in financial background. So make sure that those various sectors and individuals are represented at the table. And that is one of the things that I would encourage my male counterparts to always consider.
Monica, as a board member and in fact the incoming chair of the American Heart Association, you are intimately involved in advocating for patients and making sure they get the care that they need. The patient today is insisting on a stronger voice and more input into their healthcare decisions and how they will pay for that care. The industry, though, in the past has been more physician, hospital, and other provider focused, and as a result of that, most companies have built their education and sales structure entirely around the provider focus rather than the patient focus. Can you provide some insight to us on how innovative medical device, pharma, and other companies can get more engaged with the patient and address those needs that patients are now voicing in a very strong way?
Right. You know, one of the things is we always have to remember why we're here. You know, we always talk about the why of what you do. Well, in healthcare, that why is the patient. You know, now we have conversations about the consumer with the understanding that patients are also consumers of goods and services. And so based on that, they should be at the heart of any decision that is made. That is one of the reasons that I got into the healthcare industry, and in particular working for a healthcare system, and in particular a nonprofit healthcare system. It's the understanding that patients have to be at the core of healthcare. And again, it goes back to my value system of wanting to improve the lives of individuals that we touch. And how do we make sure we do that on a daily basis? And part of that is listening to the consumer or the patient's needs and understanding what they need. Living in Memphis, Tennessee, of course, where the poverty level is extremely high, I also recognize that there are a lot of patients whose voices often aren't heard. And that's simply because they don't recognize, quite frankly, that they're going to be in need of healthcare services. Or in dealing with poverty every day, and you're trying to just figure out how to make ends meet, those individuals aren't thinking about how am I going to pay for the healthcare services that I need. So for me and the organization that I'm a part of, Methodist Le Bonheur Healthcare, our goal is to ensure that when we're at the table, we represent those individuals who sometimes don't have a voice for themselves. Remembering that we have to be an advocate for those individuals, being intentional about getting into the community so people can understand more about healthcare, so they can understand more about their body, so they can understand more about the diseases which impact our community. So recognizing that a large degree of the patients that we serve in our organization are what we considered self-insured, which quite frankly means no pay. We have to make sure that we're considering those patients when we're making decisions. And so we're very intentional about getting into the community, whether it's through health fairs or being intentional about investing our money in economic development for those patients, or in areas where we feel will have the greatest impact on patients who don't have a voice.
Is it fair to say that on the life sciences company side of that, it's very important that they also become involved in the communities and make patients aware of what their healthcare needs are that they don't even know, as you mentioned earlier, and that there are solutions and resources out there?
Absolutely. I mean, we all play a role in that.
Right.
If we think about healthcare on a national level, we just finished an election. And there were so many people, as they were thinking about what was important as they went to the polls, the most important thing was healthcare. Mm-hmm. And so if we are in that space, we have to hear the needs of the consumer, the needs of individuals on a national level, that we got to figure out how can we help them improve their healthcare. And that means that we've got to get creative. We've got to make sure that we are being intentional about those people who aren't even aware of how healthcare and the health system impacts them. To get involved, to make sure that we are investing in community. And again, that goes through every sector of healthcare.